Hello and welcome back to the Gut Health Dialogues podcast. I'm Alyssa, your gut-friendly dietitian, here to help you explore the world of gut health and natural solutions for functional gut issues. If you've ever felt sluggish after a meal, struggled with bloating, or experienced headaches, anxiety, insomnia, or brain fog, maybe you've also noticed things like hives, eczema, or chronic sinus problems. Today's episode is going to be a real eye-opener. We're diving into histamine intolerance, what it is, how it affects you, and what you can do about it. In fact, if you're dealing with digestive issues like SIBO, small intestinal bacterial overgrowth, there's a significant chance that histamine intolerance could be playing a role. Research suggests that around 30 to 50% of individuals with SIBO also experience some level of histamine intolerance. So today we're going to explore how this condition overlaps with SIBO and compare it with a slightly different condition called Mast Cell Activation Syndrome, as they have distinct features. So let's dive in. Let's first talk about what is histamine intolerance. Histamine is a natural chemical found in both the foods we eat and it's produced by our body. It plays a crucial role in our immune response, helping to regulate various functions like stomach acid production and nerve signaling. Typically, histamine is released in response to real threats such as pathogens or infections. For example, if you get an infection, your body releases histamine to help combat the invader, which can lead to inflammation and other symptoms that are just part of you healing. However, sometimes the immune system makes a mistake. So an example of this is in the case of allergies. Your body incorrectly identifies harmless substances like pollen as a threat. This mistaken identity triggers a histamine response, even though there's no actual danger. This response is what causes the symptoms of allergies such as itching, sneezing, and swelling. So think of it as your body is trying to attack a perceived invader, your immune system, which is like your body's military or bodyguards. They're trying to attack a perceived invader, and your tissues get hit by friendly fire. It's just part of the healing process. But if histamine is doing its job, it will kill off the pathogen and then downregulate that response. So you'll only feel that way for a little while. And of course, in the case of allergies, it's targeting something that's not really harmful. So you can deal with these symptoms ongoing because the actual pollen is ongoing, especially during certain seasons. Now, histamine is usually broken down in the body by an enzyme called diamine oxidase, or DAO, which is primarily produced in the intestines. When DAO is not functioning properly, or we're not producing enough, or the amount of histamine in your system exceeds your body's ability to process the histamine, then it can accumulate and lead to symptoms like bloating, headaches, and actually quite a few more. Since DAO is produced in the gut, issues with gut health can reduce its production, allowing histamine to build up and trigger symptoms. So this is actually one of the biggest ways that histamine intolerance occurs. So think of DAO, it's like the cleanup crew for histamine in your body. But if you have a condition, for example, SIBO is a great example because SIBO is a bacterial overgrowth in your small intestine. And this causes inflammation in the small intestine, and so this DAO, by the way, is produced in the brush border of the small intestine. We do have quite a few digestive enzymes that are produced in the brush border of our intestine. So I don't know if many of you know this. If we think of digestive enzymes, we often think about the pancreas because the pancreas certainly produces digestive enzymes. The pancreas produces protease, lipase, amylase to digest proteins, fats, and carbohydrates. But we also produce certain enzymes in the brush border of the small intestine, and DAO is one of those. So So SIBO causes inflammation in the small intestine, which decreases our DAO production, or I should say it can, not in all cases, but it's very common for it to decrease our DAO production. And so by clearing SIBO, we do see that DAO, effect is improved. So the production increases because we see reduced histamine intolerance. Now, getting back to symptoms of histamine intolerance, these are going to be, think histamine is it is the mediator, the inflammatory mediator that is released in a true allergy. So histamine intolerance can cause not only digestive symptoms, but the typical symptoms we think that are associated with allergies. So headaches, dizziness, sinus issues, skin problems. So if you have digestive symptoms, in addition to some of these other typical allergic type symptoms, think about histamine intolerance. So if you think histamine intolerance might be at play, you want to look out for, here are a few kind of red flag warning signals that histamine intolerance might be going on. So if you notice, this is a big red flag for me. So let's say somebody comes in and I'm working on them for, let's say they have IBS and they have diarrhea and bloating and all those typical IBS symptoms. And we start the low FODMAP diet to start helping them calm their symptoms down. If their symptoms get worse on a low FODMAP diet, that can be a clue that histamine intolerance could be an issue. And that might be because while you're avoiding low FODMAP foods like onion and garlic and certain fruits, certain vegetables, you could end up eating more foods that are actually high in histamine. So examples of that might be cheeses, cured meats, maybe fermented products like soy sauce or kombucha, because those are foods that are allowed on the low FODMAP diet. And whenever we have to cut out certain foods, we can end up eating more of other foods. So for those sensitive to histamine, those foods are going to aggravate symptoms, even if they fit within the low FODMAP guidelines. Another red flag is being very sensitive to various foods, household chemicals, or supplements, where you feel like you're just reacting to everything. I always think about histamine tolerance when clients tell me I have to be careful with what I take with supplements because I don't react well to supplements. I'll hear that a lot, or I react to all kinds of different fragrances and skincare products. So when your system is super sensitive and hyperreactive, that might be a clue. And of course, gastrointestinal symptoms are also a clue. Things like diarrhea, heartburn, bloating, abdominal pain, more so than those with constipation or bloating. You might also experience neurological symptoms like headaches, anxiety, insomnia, and brain fog, or circulatory symptoms such as hot flashes, fluctuations in blood pressure, or rapid heartbeat. So these can all point to histamine intolerance. And then lastly, skin issues like hives or eczema are also big red flags to consider. So how do we know so these are our red flags, maybe we have some of these going on. How do we know if we have histamine intolerance? Identifying histamine intolerance can be a bit tricky since there's no specific lab test for it. Instead, we have to rely on a combination of evaluating symptoms, analyzing your diet, and sometimes exploring other diagnostic tests that can give us clues. For example, blood tests, stool analysis, or breath testing might uncover underlying conditions like SIBO, which can be a clue that histamine tolerance could be at play. And ultimately, diagnosing histamine intolerance often means ruling out allergies and observing whether symptoms improve on a low histamine diet. What I mean by that is you might get allergy testing to see if you have any food allergies. And if you can't pinpoint anything like that, just do a trial of a low histamine diet. And we'll talk about that more in a few minutes. So as far as evaluating symptoms, start paying attention to any symptoms you might be experiencing. Note any patterns related to high histamine foods. So I definitely recommend keeping a food and symptom journal. Histamine symptoms, it's nice when we're looking for histamine because when you're food journaling for something like FODMAP intolerance, FODMAP intolerance has to do with bacteria in the gut. So whether we have an overgrowth in the large intestine or in the small intestine, the FODMAPs can feed those bacteria, and that's the majority of how FODMAPs cause symptoms. So because of that, when you eat a high FODMAP food, there's typically a delay because the food has to get to wherever the bacteria is, whether it's somewhere in your small intestine or your large intestine. So you're not going to feel an immediate response. But with histamine, we do. The symptoms will often show up more immediately. And that makes interpreting the symptoms easier when you're using a food and symptom record. Now, if you try this and you're struggling, don't get frustrated. It is challenging to sometimes figure these things out. So I recommend taking a couple weeks and just collecting the data. Don't try to drive yourself crazy figuring out what's causing what right away. So I would wait till you have a couple weeks of good data of exactly what you eat. Make sure you're listing the ingredients don't write down in your food record, I had a sandwich for lunch. List everything that was in there because how else are you going to evaluate? The details matter. So list everything that you're eating, everything that you're drinking, and then list any symptoms you have. Just write them down. Just collect the data. And then after a couple weeks, then you can go back through your food records and analyze for patterns. Common culprits these are the ones I see a lot. Aged cheeses, which is most cheeses, unless it's a fresh buffalo mozzarella or a fresh ricotta. Most cheeses are aged cheeses. And in general, histamine is gonna think aged with histamine because histamine tends to build up in food as it ages. So foods that are aged are going to be the foods that are higher in histamine, and even leftovers as they get too old in the fridge can build up histamine. Common culprits: aged cheeses, fermented foods, cured meats. Certain fruits and vegetables are just naturally high in histamine, and alcoholic beverages. So if you feel awful every time you have even a glass of wine, yeah, that could be a signal. I think of also maybe sulfur intolerance when I think of wine. So if you feel awful after a glass of wine, you could have histamine intolerance or sulfur intolerance. If you feel awful after just a vodka drink, then it's histamine because wine and beer have sulfur, but alcohol in general can trigger a histamine response. So see if your symptoms align with these foods and consider cutting back or removing them from your diet. And see what happens. So, and consider it a trial. We don't want to stick with any food elimination long term if it's not helping. So, define a defined period of time. Come up with a defined period of time. 2 weeks is always a really good guideline for a food elimination, and eliminate it or more than one food. Because if we're talking about histamine intolerance, we want to look at the foods we're eating that are high in histamine and remove all of those for that defined period of time, and then monitor our results. Now let's talk about the difference between histamine intolerance and MCAS. A lot of you who are attracted to this podcast topic might have MCAS, and so that is Mast Cell Activation Syndrome, and that might be what caused you to be interested in this podcast episode. But there is a difference. We have to draw a distinction. And a low histamine diet can help with the symptoms of MCAS. So there is some overlap, but there are a few differences between MCAS and histamine intolerance. Both conditions involve histamine-related symptoms and dietary adjustments, but they have distinct underlying causes and diagnostic criteria. The similarities between MCAS and histamine intolerance are both MCAS and histamine intolerance cause similar symptoms, including gastrointestinal distress, headaches, skin reactions, respiratory issues. Dietary changes aimed at reducing histamine often provide relief for both conditions. And since the symptoms are chronic, they both can significantly impact your quality of life, affecting your daily functioning and overall well-being. The distinctive characteristics of mast cell activation are that MCAS happens when mast cells become overactive and release not just histamine, but other inflammatory substances as well. It can be triggered by a range of factors like allergens, stress, medications, and physical activity. And diagnosing MCAS usually requires specialized tests to measure markers of mast cell activity like serum tryptase levels or urinary prostaglandin D2 metabolites, especially during flare-ups. Distinctive characteristics of histamine intolerance. Histamine intolerance is often due to impaired histamine metabolism or breakdown, typically because of reduced activity of the DAO enzyme. It's usually triggered by high histamine foods or substances that cause histamine release in the body, such as fermented foods, aged cheeses, and alcoholic beverages. And diagnosis primarily relies on clinical symptoms and dietary responses, though sometimes you can use certain lab tests to give some indirect insight. So I guess the way to look at this is MCAS involves overproduction of histamine, while histamine intolerance involves a problem with breaking down histamine. Now, let's talk about dietary interventions. So, to manage histamine intolerance, focusing on dietary changes is a key part of the process. We always want to look at what's underlying the histamine intolerance and make sure we're addressing that, because those of you who know me and are familiar with my work, I'm all about fixing the root cause so that we don't have to restrict foods we love long term and then deal with the potential effects that comes from being on a restricted diet as well. So we want to initially focus on dietary changes. This is what helps us feel better right away while we're working on the root cause. To manage the histamine intolerance, we start with dietary changes, and that helps to reduce the histamine buildup. And we only need to reduce high histamine foods to the extent that's necessary to get our symptoms under control. So there's a whole spectrum that you could be on, as far as a mild intolerance up to a severe intolerance, and you need to find where you are on that spectrum. We want to break this down. There are 3 categories of problem foods when we think about histamine. There are going to be high histamine foods. These directly contribute to histamine levels in the body. There are histamine liberators. These are foods that can stimulate more histamine release. With these, there is limited evidence on these. So this is that we don't have a lot of information on histamine liberators. That's solid. And then we also want to consider other biogenic amines, and that could be other compounds like phenylethylamine or tyramine that can also just interfere with histamine breakdown, and that contributes to histamine buildup in the body. Now, with these, their exact role in symptoms is also a little uncertain. So those are the 3 factors we need to think about. And if you've researched this before, you've noticed that a lot of low histamine diets will eliminate high histamine foods, histamine liberators, and sometimes biogenic amines like phenylethylamine, tyramine, leaving you sometimes with very little to eat. I would say, because there's limited evidence on how histamine liberators trigger histamine release and how other amines contribute to symptoms, I usually focus on starting just with reducing or eliminating the high histamine foods. And for most of my clients, that does the trick. And again, we're also focusing on other factors. We're looking at comprehensively what's going on in the gut, but I usually do just fine focusing on high histamine foods. So that's what I'm going to talk about here. We talked a little bit about this earlier, but let me just go down the list in a more complete way. So foods that are high in histamine, and by the way, guys, I'm going to put my guide in the podcast show notes. So you can check out the podcast show notes. I actually will put a link to my blog post on this, my histamine intolerance blog post on this, which will list in a complete way all of these foods that we're talking about. And then also I have a link to a 4-week low histamine diet plan, which includes 4 weeks of meal plans and recipes and a grocery list for each week. Check those in the show notes. So don't feel like you have to scribble down notes on this, but foods to limit or avoid: aged or fermented foods. That's aged cheeses, fermented soy products, soy sauce, sauerkraut, kombucha, kimchi, yeast, beer, cider, wine. How sad is that? Again, I just can't help myself but insert that whenever you eliminate a food, and it's hard to do, it's one of your favorite foods, just keep in mind that in most cases it's temporary till you can figure out and get your gut healthier. So just look at it that way. And also, if you eliminate the food and you feel better, that doesn't mean you have to avoid it completely. You might be able to have a little bit of it some of the time, especially once you eliminate some of these others that maybe don't matter to you as much. Then maybe you can reintroduce like this favorite food in small amounts less frequently and tolerate it. So our first step is just, is histamine an issue from foods for me? And that's when we'll go more strict with it. And that's why I recommend coming up with a defined period that you're just going to go strictly pulling out all of these foods. So that's why I say just set a start and end date and then evaluate how much it's helped. And then if it's helped, you reintroduce the foods to figure out how much you can tolerate. And if it hasn't helped, you abandon the project. And I will just say that with the ones there's more to the list that I'm about to read off, but with the ones I just listed off, it is a big red flag to me when someone they tell me they're trying to improve their gut health. So I see that they're drinking a lot of kombucha, eating sauerkraut, getting all these wonderful prebiotic foods. But if they're having any type of allergy symptoms, I definitely think, okay, they might be contributing to their histamine load. Other high histamine foods to try avoiding would be the vinegar and foods containing vinegar. Now, that's not all vinegars. It's generally the wine vinegars, because again, think about aged foods. But it can be hard to know exactly what type of vinegars are in a food. So I do recommend for this trial avoidance, just avoiding anything that has vinegar. That would be like pickles, salad dressing, mustard, ketchup, and mayonnaise. I know, very sad. Processed or cured meats. So that would be deli meat, sausage, bacon, canned or processed foods, canned soups, sauces, and vegetables. Again, that's because they're aged. They've been on the shelf a long time. Certain fruits just naturally have a lot of histamine, things like berries and bananas and pineapple. Certain vegetables like tomatoes and spinach, eggplant, obviously fermented vegetables, and certain nuts and seeds. And then beverages like alcohol, coffee and tea, and energy drinks. Let's talk about what you can eat. You're going to choose low histamine foods to build out your diet over this couple of weeks. That's going to be fresh meats like chicken, turkey, beef, lamb, and fish. Now, fish is, okay, I have to put a big asterisk here, because you might need to avoid fish if you live in a place like Arizona, like I do, because a fish is okay as long as it's freshly caught and frozen immediately or eaten immediately. And so you have to live in a coastal area where that's the way that fish is handled, or you would have to know how the fish was handled. And so for most of my clients here in Arizona, I recommend just avoiding fish, because we can't know when we go to the grocery store that the fish was fresh caught and immediately frozen the same day. Fresh vegetables, leafy greens, these are things you can have. So I'm sorry, I mentioned fish. So let's go back and say fresh meats. What's okay? Chicken, turkey, beef, and lamb. Fresh vegetables, leafy greens, broccoli, cauliflower, carrots, cucumber. The list goes on. Zucchini, squash, sweet potatoes, fruits, apples, pears, cherries, grapes, melons. There's just a lot. So check out my blog post for the full list. Grains and starches, You can have pretty much any grain or starch: rice, quinoa, oats, gluten-free pasta or bread, corn, buckwheat. If you're not on a low FODMAP diet, even wheat would be okay. Or if you're not gluten-free, dairy alternatives: almond milk, coconut milk, rice milk, or even dairy if it's fresh. So just regular, if you can tolerate lactose, just regular cow's milk, or even lactose-free cow's milk. We just can't have the fermented dairy, so no yogurt or cheese. And then fats and oils are okay. Many herbs and spices are okay. And then as far as, so herbs and spices, that's what I would recommend to flavor your food: a little butter, a little salt and pepper. You can use apple cider vinegar, so you could make dressings out of that. You can use mustard powder, maple syrup. So you can be creative with that for flavoring your food. Now, some nuances to the diet. To effectively manage histamine intolerance, you want to focus on fresh, minimally processed foods and avoid leftovers. You can actually have leftovers the next day, but I wouldn't go much beyond that. And that's because histamine can build up in foods over time. So how you store and handle food plays a big role in your symptoms. So you want to prioritize proper food storage and cooking techniques to keep histamine levels as low as possible. So when grocery shopping for histamine intolerance, especially for fresh meat and fish, you want to consider, when purchasing raw meat, opt for whole cuts, choose quickly butchered and frozen meat, and avoid high histamine shellfish. Or I would say, select fish only if you know that it's been gutted and cooled or frozen properly. So if you're not sure, I would err on the side of caution and avoid it. And then as far as food storage and preparation for histamine intolerance, maintaining freshness is the key. So for optimal consumption, eat foods fresh and then freeze them as soon as freeze, first of all, as soon as you get home from the grocery store. Freeze things that are like meats, for example. Freeze them right away, and then thaw them, cook them immediately, eat them fresh. And I do find, again, that my clients tend to do fine, my clients with histamine intolerance, eating leftovers the next day, just not beyond one day. Again, you're going to come home from the store, freeze the meats, defrost them promptly, and then cook them right away. So promptly just means defrost them on the counter in the fridge and cook them as soon as they're defrosted. And that limits the histamine buildup. Make sure, some other tips, making sure you purchase in small quantities and freeze excess. Okay. I have a list of low histamine snacks here. So you can do fruits, apples, pears, grapes, vegetable sticks like carrots, cucumber, bell pepper, celery, rice cakes. You can top rice cakes with almond butter, or maybe like a fresh buffalo cheese, buffalo mozzarella cheese, hard-boiled eggs, nuts and seeds like sunflower seeds or pine nuts. A homemade smoothie might be a good option. A homemade trail mix might be a good option, just with allowed ingredients. So for snack ideas, just defer to my blog post to get ideas on that. Now, let's talk a little bit about supplements for histamine intolerance. Certain supplements can potentially help to manage histamine intolerance. And the one that I use the most is DAO enzyme. It's actually supplementing with the enzyme. And that can help, and that's especially helpful if you're eating out and you don't know exactly how the food was handled and exactly what the ingredients are. It's very obvious if you're eating fish, if you have fish on your plate or not. That's easy, but you don't always know what exact vinegars did they use in this. Did they use only low histamine ingredients? So eating out is tough, regardless of what special dietary considerations you have. But taking the DAO enzyme can be especially helpful. So that's one of my tips for people with histamine intolerance. Go out, to eat. Order carefully, but also take that enzyme. At home, you can be more careful and just avoid the high histamine foods. And for those also, maybe you're super, super sensitive. Taking the enzyme even while you're trying to eat low histamine can be helpful. Another couple things that can help, quercetin. Quercetin can stabilize mast cells, and that reduces histamine release. And also vitamin C. Vitamin C can help lower histamine levels and boost immunity. Bottom line with this is going to be finding the root cause. So what are some of the root causes? So root causes of histamine intolerance, it's related to the enzyme deficiency of the DAO enzyme. So this can happen with various gastrointestinal disorders. We've talked about SIBO or leaky gut, but it could be related to other gastrointestinal disorders. Anything that causes, so for example, Crohn's, anything that causes inflammation in the gut could potentially contribute to histamine intolerance. Also, microbiome imbalance, disruptions in gut bacteria. Certain medications can affect DAO or histamine metabolism, and that would be things like antihistamines, certain antidepressants, and NSAIDs, non-steroidal anti-inflammatory drugs. And also just a genetic predisposition. Genetic factors can also impact histamine metabolism. Finding the root cause often involves looking at your medical history, your diet, your gut health, and lifestyle. And my two favorite tests for if you do have gut issues, you want to go to the doctor and potentially see a gastroenterologist to see what's going on. Start maybe with your primary care doctor, get a referral to a gastroenterologist. So you do want to be evaluated. And if you've been evaluated by a gastroenterologist, maybe you've had a colonoscopy, an endoscopy, the blood test, the scans, maybe you've been fully evaluated and they still can't find anything wrong. My favorite functional test to identify what is actually out of balance in your gut from a functional standpoint is a SIBO breath test and a comprehensive digestive stool analysis. So those are some things to think about as far as helping evaluate root causes. Now, I just wanted lastly to address reintroduction of foods because I can't emphasize enough that because it's just so tempting once you identify your food triggers to want to stay there. But when you pull out food triggers and you just stay with a limited diet, that gets old really quick and it can set you up for potential nutrient deficiencies and other issues down the road. So we do want to make sure that anytime you do an elimination diet, do not get stuck in the elimination phase. I see this a lot with low FODMAP as well. People will eliminate FODMAPs, feel better, and then they just stay there and they call it the low FODMAP diet. Staying in the elimination phase is not the purpose of the low FODMAP diet. You're supposed to then reintroduce the foods so that you're only limiting yourself to the extent necessary to control your symptoms. So as far as histamine elimination, after 2 weeks, if you found that it was helpful, your symptoms have calmed down, then you start reintroducing foods. And anytime we reintroduce foods, here we've pulled out foods, we feel better. When we reintroduce foods, we're setting ourselves up for the risk of triggering symptoms. So you want to start slowly, reintroduce one food at a time, and monitor symptoms. Watch for any adverse reactions. Definitely keep track in a tracker, either on paper or with an online tracker or a tracking app. Keep track of your foods and your symptoms and the different foods that are new that you've added on the days you've added them, so that you can really correlate and see at a glance the new foods added and the symptoms that were provoked. And if there are foods that you tolerate, then you can slowly increase the amount. Remember to control your variables. You only want to focus on adding one new food at a time or increasing the amount of one new food at a time. So it's very clear if you do get symptoms, what's causing it. And then allow a few days after each food before reintroducing another food that can help you calm down any symptoms you provoked, or just reset your baseline so you have a clean slate for the next food challenge. Consider getting professional guidance with this because it is a really nuanced thing. Consider working with a dietitian. This is definitely something I do in my practice all the time, but consider working with a dietitian who has a gut health focus to help you with this if needed. All right, you guys, histamine intolerance can be challenging, but with the right strategies and support, you can manage it effectively. And remember, I'm here to help. If you have questions or need personalized support, don't hesitate to reach out. In fact, I have a Facebook group that's free. It's a great community and we support each other. You can ask questions. I'm actively involved, so I'll be able to answer questions for you all for free. So I'll put the link to that in the show notes. And also, if you haven't yet, be sure to download my 4-week low histamine diet plan in the show notes. It is packed with a very complete meal guide, so you can just hit the ground running. All you have to do is buy the foods on the grocery list and just follow it. There's no thinking or no stress, I should say, involved or time-consuming meal planning. So thank you for tuning in today to the Gut Health Dialogues, and I will see you all next time.